My name is Sharon Kroll. I'm Head of Education and Practice Development at the James Paget. We use an acronym of CLiP, which is Collaborative Learning in Practice. This was a new model that we'd witnessed in Holland, which we felt was very supportive and very beneficial for our learners, which enables the students to have a day coach. And what we try to do is have a mixture of first year, second year and third year students in a ward area, and allows the third year student to very much support the second year and the second year to support the first year. Obviously with the registered practitioner there to look and to supervise, and obviously step in if they need to. One of the nurses explained to me right at the beginning, and I think this summarises the approach very well, that the student nurse steps forward and the registered nurse steps back, and that's how the coaching model works and its ethos behind it. We felt it was really important to implement it here at the James Paget because we were really keen to enhance our learning environment, and it seemed to be a really good way to allow students to develop their confidence, to be confident practitioners upon qualifying. It allowed them to really understand what it was like to be a staff nurse and get a greater appreciation of that role. It also allowed us to enhance the quality of the experience for both mentors and the rest of the staff on the ward, and ultimately did allow us to double our placement capacity. By increasing the capacity, it's allowed us to have more students into our area, which we're really keen to do. But ultimately, it is about the learner's experience. And I think students have felt very much part of the team, a valued member of the team. Medical colleagues have commented on how beneficial this has been. And I know students have stated that actually having had the experience of a coaching model, that they have chosen us as a place of work upon completion.
I think CLiP has enabled students to work better after they've been registered because it supports their general knowledge of their patient and their ward base. It helps them to delegate their care better, and it enables them to do better bay management. The patients see the benefit of CLiP because there's more people available within the bay to support their care. They get one-to-one from the students, nurses themselves. So they get individualised care that is directly for them, and the students themselves are working with those patients 24 hours. When you compare coaching to mentorship, you're looking at the individualisation of the students. You're supporting their skill by allowing them to deliver the care, whereas with a mentor you're actually standing behind them, watching them deliver the care. So coaching enables somebody to actually deliver the hands-on, rather than watching it being delivered hands-on. It supports their growth and knowledge.
Coaching compares differently to mentorship because you get a little bit more independence. So when you're mentored, you tend to spend a lot of time with just one person. Whereas with coaching, as part of CLiP, you are a bit more independent.
Mentorship can sometimes feel like it's quite full-on, which you can sometimes feel like your mentor is in your pocket a little bit, whereas coaching makes you feel a little bit more like you've got more autonomy over the care that you're delivering, which is quite nice.
What I enjoyed about my CLiP placement is the fact that I can ask other students about their experiences. They would tend to have a bit more knowledge about the position I was in as a student, rather than a registered nurse who perhaps qualified a few years ago. So they could relate to me a lot better than anyone else in the ward.
I enjoyed with my CLiP placement that it boosted my confidence as I got to work with other students and they asked me questions and I knew the answer.
I really enjoyed the peer support with other students. So when I was in CLiP in year 2, we were working with year 1s and year 3s, and we were worrying about our exams in year 2, but the year 3 could kind of settle us and say it's not too worried, don't worry about it. And then the year 1s can ask you questions, like they were worried about their OSCEs and you think, oh, OSCEs are fine. So it was nice to have someone to talk to about what you've got to do next.
A good coach is an approachable person who you can go to with any problems, personal or whilst on the ward. They're a good listener and they will sort out any problems you will have whilst on ward.
I think a good coach is somebody that's approachable, but at the same time gives you the autonomy to go and deliver your own care and make your own decisions for people.
There were times where we were a bit lost about what we should be doing on the wards. We had run out of jobs perhaps, and because we only had 4 patients between 3 of us, I think we could have a few more patients and maybe be a bit more busy.
I think sometimes one of the disadvantages of the CLiP model is that there are quite a lot of students in one placement area, and sometimes you can maybe feel like you're not getting as much contact with trained nurses.
You become more confident in the way you can practice because you're given, like I said, more independence, and your coach is there if you need them, but everything else you can talk to your year 3s or your year 1s about and get more support within that environment rather than having to constantly ask the nurses.
Following my experience of CLiP, I have changed because I feel more competent and confident in being a student nurse, and I think it will help my transition into a staff nurse.
CLiP has definitely increased my confidence, probably from having second years and third years to ask questions from throughout my training, and then as a third year being able to kind of coach second years and first years and answer their questions as well. I think it definitely builds your confidence.
I definitely feel I would be ready when I'm newly qualified to manage a bay, whereas before I would be worried about asking people to do things for me and like delegating and stuff. So as a newly qualified, going from CLiP as a year 3 running a bay, it would be a smoother transition rather than being thrown in at the deep end and not really knowing what to expect.